My name is Scott Budgell. I'm a public health inspector for Alberta Health Services. I've been doing this job for approximately 30 years. I work out of the Red Deer office. In the meantime, in between being a health inspector, I've had various other jobs, and one of them has been a board member for HSAA. I went through my schooling. I started my job in Edmonton, and they said, "Oh, Ralph Klein has cut 5% from our budget." And they didn't tell us how we were going to cut 5% from our budget, but we decided to eliminate positions. So sorry, you're gone. I'm like, okay. So then I got a job in Red Deer, where I've never left. I started in Red Deer and they said, "Oh, Ralph Klein's 5%, and that's going to be a 5% pay cut to you." I'm like, so I lost my job and got a 5% pay cut. And didn't really like it, didn't really understand it, but back then our Red Deer office was quasi-union, meaning they followed everything the union said, but we weren't a union. And so I think it took us 3 tries to try to get that office unionized, right? And then we finally did that. It was surprisingly difficult, because at that time, I didn't really understand union rules, or who all was involved. So it was a very steep learning curve, right? Union in our old building was OTPTs, occupational therapists, physical therapists, speech therapists, and us, right? And our new building, it's like dental, school health. We don't have the OTPTs or the speech anymore. But, you know, when you start realizing there's so many people involved in the union, and everybody has their own wants and needs, and trying to convince them to become union, right, and give up a portion of their paycheck, because under our old agreement, joint personnel agreement, there's no union dues. So people had to see some benefit to giving up money, and that was the hard part. When I first became a board member, lots of things were on the plate for me. Lots of things I didn't quite understand, but it's a great free education, and that's what I want people to know about the board, is like, go there, get educated, it's free, and you'll become a better person for it. One of the things I was quite proud of, I never knew that the board actually lobbied the government. So I volunteered for those, because I thought, what a better way to do things. So I was involved in Blood Watch, which was trying to keep for-profit companies out of Canada paying for plasma. Because all they do is harvest the plasma from people, and then they sell it back to our hospitals, because we need the plasma. Beforehand, people would just go and give it, and it was free. Probably repeating myself, but my vision for HSAA would be more diversity. I know they're diverse as it is. We have different groups, right? But that's more driven by the membership than by the union. So young workers, right? That was driven by the membership. They wanted more involvement. So we got a committee for them and that sort of stuff. I'd just like to see more diversity, more membership, more voices at the table, right? So if we had more programs represented, then we'd have better representation and we'd be better able to understand the workforce. It'd be better.